欢迎参加成都市政府新闻办举行的新闻发布会。
Good evening, dear reporters.
疫情发生以来，
Welcome to the press conference held by Information Office of Chengdu Municipal People's Government. Since the outbreak of Pidou District in Chengdu City, the municipal government and the provincial government have taken decisive measures to prevent the spread of the outbreak in order to safeguard the security and health of our people. Today, we are very honored to have with us leaders of the government, of the city government, of the district's administration to brief you on the latest situation and will be taking your questions. With us are with the Chengdu CDC, Mr. Sichuan, and Chengdu Health Commission, and Mr. Wu Yeyong, the head of Pidou District. From Sichuan Health Commission and Huadu Hospital, Mr. Hua Rongsheng. First of all, let's give the floor to Mr. Xie Chang to brief you on the latest updates. Good evening, ladies and gentlemen. First of all, please allow me to brief you on the latest updates of the outbreak. As of 16 o'clock today, the total number of report cases is 10, and two asymptomatic cases. And we report 2 new cases as of 18 o'clock today, all in Pidou. And 1 is a close contact of a confirmed case. So case 1, Mr. Zhang, age 54, is a migrant worker. It's living in Pidou District in Taiping Village. It's a close contact of a previous confirmed case and has been tested positive on the nucleic acid test of yesterday. And he was reported as an asymptomatic case yesterday and was revised as a confirmed case today. And because of the CT abnormality today. And he has been visiting the Nanmen, the grocery market and some other regions. In case 2, Li, and is a close contact of a previous confirmed case, has been tested positive on the 10th and has been transferred as a confirmed case as of 11 p.m. yesterday. These 2 confirmed cases have already been admitted to designated hospital for quarantine treatment, and all the location that they have been visited has been is under control and disinfection, and has been doing some epidemiology investigation, and all of the close contacts, the totals of more than 2,000, are under medical observation, and we have in total tested 1.3 million people, among which 11 are found positive, and the rest are found to be negative in terms of the COVID test. All of the close contacts have done 2 nucleic tests, and we have already shown negative results of 2,202, and rest the results are left to be found. We have tested positive on some of the environmental samples, all in the living environment of the confirmed cases. And as of now, all the confirmed cases and asymptomatic patients are admitted to the designated hospital for quarantine treatment. 3 are light cases, 6 are general case, and 1 is a severe case. According to the State Council's requirement, as of 9 p.m. today, we have designated one mid-risk region, one more mid-risk region. And for the residents who are living in this region, they cannot go out without special permission and approval in order to ensure the security and health of all the residents. From 6 p.m. today, we carry out free COVID-19 treatment for all the residents in Pyidu district. We have set up 377 testing locations. Make sure that if you're living in this area, go to one of these testing spots to get tested with your masks on and keep social distance. And we will be releasing information in a timely manner so as to handle the outbreak in a timely and appropriate fashion. Thank you, Mr. Xie. Now the floor is open to questions. Please identify yourself before raising the question. Thank you. With CMG and CCTV, we've been noticing that Pyidu district has been carrying out COVID testing, and from today, it's a general test of all the residents. So can you tell us more about this general testing of all the people living in Pyidu district? I will refer this question to the head of district, Mr. Liu. From December the 7th, 1 case was confirmed in our district, and we have begun the wartime situation in our district. And we've been following the important instructions of the city and provincial government. Our mayor and deputy mayor and other municipal leaders has been visiting our district multiple times to see that for sure that the work are being done in a proper manner. And we have also sent out medical experts to supervise the containment work. As of 6 p.m. today, we have tested and quarantined more than 600 close contact and people with second close contact. And we've done tested of more than 57,000 person times. And more than 1,100 special personnel and medical workers have been allocated to help us with the testing and medical treatment. All of the students and people who are living in wholesale market and grocery market have already been tested. They are the key groups of this containment of the outbreak. From 8 a.m. yesterday, we began to identify key areas of our district, such as Furong district and other 11 communities, to carry out a second round of testing, and a total of 100,000 samples have been collected. And currently, we have seen results of more than 70,000 cases. All of them are negative. As of 1 p.m. yesterday, a case with family name Li has been confirmed as a confirmed case, as a positive case. And after that, all of the residents in this community have been tested, and it totals more than 900 residents. And a total of 310,000 cases have been collected, and currently 170,000 cases has shown result. All of them are negative. We are answering the concerns and questions of the people, and in order to bust the rumors in a timely measure, and the work and the commute of Sichuan district are as normal. I think it's important for us to carry out early detection and early reporting and early quarantine. As of today, a group of 4,000 people, professionals, are helping us with the sampling and testing of COVID-19 in several districts, including Tangshan, Sandaoyan. And a total of 900,000 cases have been collected. And we are aiming at finish the test of all the residents. And it will be a sleepless night for us today. And this will be a day for us to remember. We want to express our thanks to the cooperation of all the people for the hard work of all the carders, the policemen, and the medical workers, and of course the support and supervision of the city, municipal government, and provincial government. We'd like to also extend my gratitude for all the people who are living and working in our district in a responsible manner. Please come to the nearest sampling station to get tested. And it's very important for us. We want to also remind you that if you have ever visited our district in 14 days, especially this key areas such as Zhongtiaoweir district and the Pitong Street district, and the other key areas in which the cases have been stayed and have activities in, please make sure that you get yourself tested and conduct self-quarantine. Thank you, Mr. Liu. Next question, please. With Zhenming website, the question goes to Professor Luan. Why do some people need one test and some others need twice or even 3 times of COVID testing? So first of all, we need to categorize the patients. Or the people. Some of them can test on site, and their sample will be referred to the labs to get tested. It may only take several minutes, and will take about 4 to 6 hours for the results to turn in. Because right now we are carrying out the massive testing of all the residents here in Chengdu district. We have already tested 300,000, and we have 900,000 more to be tested. And professionals from all over the city are right now coming to our aid, and it's a group of 4,000 professionals in total. So for the key areas, we will be doing individual testing. But right now, the scope has been expanded in order to save time and improve efficiency. We will do this so-called mix testing. That is to say, we will mix 5 samples together and to get tested. If they are all negative, and it will be fine. If there is a positive, we will just ask these 5 people. We will do a second individual test on these 5 samples. So we will do this testing with 5 samples in one group, or even 10 samples in a group. This will save us a lot of time in terms of the testing. So we are expanding from Taiping Village and Zhongtieweir district to Xipu. And these are key areas, and right now has been expanded to the whole district in terms of COVID testing. And as of yesterday, we have 1 new case reported at 11 p.m., which is very late. And it has been calculated as a new case today. And this case has been tested twice. And this second case, Li, is not it's not quarantined in one of the isolation spot, but in an exterior place in which we have already been from which we have already been identified as a new region, new key region. So it makes sense for us to expand the scope, because not all the potential cases have been quarantined. So we believe that it makes sense for us to expand the scope to the whole district. In terms of lab testing, we need to extract the nucleic acid and before we get tested. And we will know the result from the CT value. If it's a single sample, the results can be shown. If it's a collective sample, if it's negative, then all of these 5 or 10 people are negative cases. If it's a positive, shows positive results, these 10 people or 5 people will be asked to come again to do a second test to make sure who is the positive case. So the reason for us to do multiple testing is only found in individual cases, in very special circumstances. Normally, you don't have to do it multiple times. But there are some situations, if you're living in the key areas or you have a higher risk of infection. For example, if you're a close contact of one of the confirmed cases or asymptomatic case, at the early stage of infection, You may not show positive results when you do the testing because the amount of virus is quite low at the early stage of infection. Or due to some practice or mistakes in practice, he might show false negative. So that's why we need to do a second round of testing. The 4 cases of yesterday are all found in the second round of testing. So actually, this kind of positive rating during the second round of testing is not very high. We do a second round of testing to make sure that no case is left out. And after the quarantine period is finished, we have to do another round, a last round of testing before this person get discharged. So for these key cases with a higher risk of infection, we need to do multiple testing to make sure. Because single test might have the possibility of false negative due to the low amount of virus or some cases, some mistakes in the testing processes. So that's why we have to separate the different cases. For the general public, you only need to take the test once. Thank you. Thank you, Dr. Luan. Next question, please. With Sichuan Daily, there's a difference in terms of numbers in the morning report and the press conference of today. Why do we separate asymptomatic cases from confirmed cases? Mr. Xie, can you take that question? Thank you. Thank you for your concern and interest in the containment of the outbreak in Chengdu. You have raised 2 questions. So first of all, about the difference in numbers. Since the first case that was reported in Chengdu, we have been releasing information in a timely and transparent manner. So each morning, we will be releasing the information through the official WeChat account. These are very authoritative information. And according to the national requirement, in the morning, we will be reporting the confirmed cases of 0 to 24 o'clock of the previous day. On the 7th, report the first new case of this round of our outbreak, and we've been answering the questions and reporting information in a very timely manner. And we are holding press conferences on 9 p.m. On each day to give you more detailed information on the cases. So from in the press conference and the daily press conference, the numbers will be updated to 6 p.m. on the day of the press conference. So there's a difference in terms of the time. That's why there might be difference in numbers. And from tomorrow, we will be unifying these 2 times of reporting. And in terms of difference of asymptomatic cases and confirmed cases, this is a general requirement of the State Council. And this question has already been taken by the National Health Commission. The asymptomatic patients include two types. First is potential patients or potential person of infection. They show slight or even no symptoms throughout this infection. The second group would be the people who are experiencing this kind of they are at a very early stage of infection, so they show no symptoms. But as time goes by, they will be showing symptoms. So this kind of asymptomatic patients will be transformed to confirmed cases. So I think this is a more scientific way of categorizing the cases. Last question. Since the outbreak, people have shown their concern in terms of the spread of the virus. So how do the residents improve their self-protection in order to help with the containment of the COVID-19, and especially in the winter season? And in total, we have reported 12 cases in this new round of outbreak, and 10 have been confirmed, and 2 are asymptomatic. So if you think about it, the size of the population in Pizhu district is more than 1 million, and we have reported 12 cases. And we are expanding the scope of testing and the scope of quarantine. And we need to do multiple tests to make sure that all the cases will be screened out. And there might be confirmed cases in the coming days. However, your risk of infection in your daily life is quite low. I think it's safe to say that. From the current situation, we believe that it's a very small rebound. And you don't need to worry too much about it. But you cannot relax, of course. It is still very important for us to strengthen self-protection in order to guard against a further rebound of the outbreak. So for the people, you also need to cooperate and work closely with us and participate in this effort. In terms of self-protection, some of them sound quite cliché, but they are very important. According to the medical journal published in the U.S., one of the author is Fauci, Dr. Fauci, and the American expert, which is a household name, of course. According to his article, all of the self-protection methods, such as wearing a mask, we believe that all of you are wearing a mask right now. It is a very effective way to prevent the droplets from carrying the virus into your nostril. So this kind of medical or surgical mask can effectively prevent infection in daily lives. For smaller droplets or aerosol, you need to wear N95, but it's not quite necessary to wear N95 in your daily environment because the aerosol with virus will not be floating in the air in your working location. They can only be found in medical environment or in the labs. In these cases, we will need protection and PPE of higher degrees. But make sure that you take your masks with you wherever you go. And you can choose to wear your mask when it is necessary. You don't need to wear the masks all the time. So when to wear a mask? First, in an enclosed environment with poor ventilation. And second, in locations with a concentrated population, such as in a press conference room. And three, you have to make contact with person in a close distance. You need to wear masks. For example, if you're taking a bus, the subway, of course, you need to wear a mask. This is compulsory, and in other places, you don't have to wear masks. Second requirement, wash your hands more frequently, because a very important source of contamination is through touch. If you touch a floor that has been contaminated, and then you use your hand to rub your nose or rub your eyes, you might get infected. So wash your hands. By washing your hands, you can use soap or this kind of alcohol or hand gels that can carry out this kind of disinfection on your hands and clear out the pathogens on your hands. And also, you need to make sure to reduce the contact with some of the public utensils, elevator handles, for example. Or wear a mask before touching one of these public utensils. If you use a public bathroom, the handle on the door is actually considered a source of contamination. So reduce this kind of physical contact with these public places, the handles, the public surfaces, so as reduce the chance of contamination infection. And number three, to keep social distance, to reduce the chance of public gathering, and the social distance is considered to be 1 to 2 meters, or the international standard would be 1.8 meters. With this kind of distance, the big droplets will not fly that far and will not land on your face. So social distancing is quite important. And second, to reduce gathering of the population. And fourth aspect, in the home environment and in offices, we need to strengthen ventilation and keep a clean living and working environment. Ventilation can effectively dilute the concentration of pathogens in the air, and fresh air can also help you to gain a good mood. I think a good mood is essential in order to maintain this kind of immunity in your body. These four aspects mentioned by Dr. Fauci is important. They are simple, but very useful. Wear a mask, wash your hand, keep social distancing, and indoor ventilation. Carry out indoor ventilations. These are four important suggestions that we give to all the people during this special period of time so as to stay healthy and safe. Thank you again, Mr. Luan. That's all for the question and Q&A session. If you have further questions, you can talk to us after this press conference, and we will be taking this question, give you replies through multiple channels. Thank you for your report of the outbreak. I also want to thank our speakers for attending today's press conference. That's all for today. Thank you.